Good day everyone, I am 𝐬𝐨𝐜𝐴, and today I will be showing you my return demonstration on performing the female urinary catheterization. Urinary catheterization is a process in which the catheter is inserted into the bladder to collect or drain the urine into an attached bag or container. The purpose of this is to reduce the risk of infection and kidney damage. So prior to the conduct of the procedure, I am going to check the physician's order for catheterization to ensure that I have the right patient for the right procedure. Okay. So now I'm going to perform thorough hand washing to deter the spread of pathogenic microorganisms which causes disease and contamination. After thorough hand washing, I have prepared the necessary equipment needed to conserve time and energy. So I have here a bath blanket, a light, sterile forceps, cotton ball soaked with betadine, a catheter set which includes sterile glove, absorbent pads, an eye sheet, specimen container, a lubricant, 15 to 20 cc syringe with 10 to 15 cc sterile water, a Foley catheter, urine bag, and a catheter tape. So now that I'm all set, I am now going to identify the patient using two identifiers and explain the procedure to the patient. So this is done for us to elicit cooperation and understanding from the patient. And also we're going to provide the patient with privacy by screening the patient or by locking the door of the patient's room. Good day, ma'am. I am 𝐬𝐨𝐴, your student nurse for today from Davao Doctors College. May I see your wristband, please? Can you state your full name, ma'am? Alright, how about your birthday? Okay, now would you like me to call you? Okay, so today ma'am, since you have a difficulty urinating, your attending physician Dr. Kenneth has ordered for you to have a urinary catheter. So what I'm going to do now ma'am is I'm going to insert a tube into your urethra and it will connect into your bladder for you to excrete your urine. And also ma'am, I would like you to be informed that during the procedure, I am going to expose your genital area. Would that be alright with you, ma'am? Okay, so do you have any questions, ma'am, or clarifications before we proceed? Okay, so ma'am, is it okay if I'll close the curtains and doors for me to provide you with some privacy and away from disturbances? Alright, thank you. So now position the patient in a dorsal recumbent with her knees flexed. So this will provide a good visualization of the meatus, where we will be introducing the catheter. And also the gravity will aid the flow of urine when the bladder is higher than the end of the catheter. So now ma'am, I need you to flex your knees and I'm going to help you with that, okay? Alright. So now, we're going to drape the patient using a bath blanket and expose only the areas to be used. So this is done to prevent the patient from getting embarrassed and of course from having chills, which may cause tension that may interfere with the easy insertion of the catheter. So now ma'am, I'm going to remove your top sheet and I'm going to drape you with a bath blanket, okay? Alright. Okay, so now ma'am, I'm going now to expose your genital area, okay? Right. So always remember to expose only the areas to be used and cover those areas that are not going to be used. Okay? So now, apply direct light for the visualization of the genital area. So this is my improvised light. I'm going to place it right here. So now we're going to open the set and arrange the equipment for convenience and accordingly to avoid contaminating the materials. So this is done to increase the speed of performance, and also since reaching over sterile items will increase the risk of contamination. Okay, I'm going to discard this one. So now, using sterile forceps, we're going to clean the external genitalia with the use of the cotton ball soaked with betadine. So this is done since thorough cleansing of the meatus will reduce the introduction or the possible introduction of the microorganisms into the bladder. So first, I'm going to wear the gloves to protect myself and of course my patient from cross-contamination. Okay, so now I'm going to start cleaning at the midline of the symphysis pubis down towards the anus. So always remember to never retrace a stroke to prevent contaminating the area, and also start cleaning at the area farthest from you to avoid contaminating the rest of the area. And since I am in the right side of the patient, so I'm going to start cleaning at the left side of the patient. Okay? So, from the midline of the symphysis pubis down towards the anus and then discard. And now, for the labia minora, we're going to start at the mons pubis, figure of 7, down towards the labia minora, towards the anus, and then discard. And do likewise on the other side. Mons pubis, figure of 7, down towards the labia minora, towards the anus, and then discard. And now for the labia majora. Mons pubis down towards the labia majora, towards the anus, and then discard. And do likewise on the other side. Okay, so now we're going to open the tray set while observing the proper sterile technique to maintain the sterility of the materials. But before that, we're going to set this aside first. Okay. And then I'm going to remove my gloves. I'm going to perform hand hygiene. Okay. And now we're going to open the catheter set. So always remember that this is sterile, so we're going to be careful in this part. So we're going to touch only the outside surface of the cloth, which is the wrapper. Okay, and now I'm going to wear the gloves that is included in this set. Okay. Okay, and I'm going to discard this wrapper. Okay, and now I'm going to place the absorbent pad and the eye sheet over the patient's perineal area. And after that, we're going to connect the pre-filled syringe into the catheter. Okay. Okay. So now we're going to lubricate the catheter for about 1.5 inch, being careful not to plug the eye of the catheter. So lubricating the catheter will reduce friction and will prevent urethral trauma, which reduces the pain upon insertion. Okay. So this is the lubricant. And then we're going to get the catheter. So now pick up the catheter for about 3 inches from the tip of the thumb, just like this, and then place your thumb and fingers of your non-dominant hand between the labia minora while separating and pulling off the meatus gently, as this will provide visibility. Okay. So now, Ma, I'm now going to touch your genital area, okay? Okay. So now, insert the catheter on the patient's meatus for about 2 to 3 inches or until the urine will begin to flow. So Ma, I'm now going to insert the catheter, so I need you to stay relaxed, and if you feel uncomfortable, just tell me, okay? Okay. So the female urethra is approximately 1.5 to 2.5 inches, and relaxation of the external sphincter will allow the easy insertion of the catheter. Okay, so now ma'am, I'm now going to insert the catheter, so just stay relaxed, ma'am. Okay. So now, if a specimen is to be collected, we're going to pinch the catheter using our thumb and fingers, and we're going to place the specimen container on position. So this is done since the urine will flow out on the catheter if the lumen is not occluded. And I'm going to grab the specimen container using my dominant hand since this is sterile, and this will maintain the sterility of the container. Okay, and I'm going to pinch the catheter using my unsterile hand. And I'm going to place it right here. Okay. Okay, and that's it. Okay. And then rest your hand on the patient's pubis, okay, while holding the catheter on place to avoid pulling and pushing of the catheter, which may cause contamination on the urethra. Okay? So now we're going to collect or going to connect the urine bag into the catheter while making sure that the urine bag is closed to avoid leakage. And of course, this will maintain the sterility of the connection. Okay? I'm going to open the cap. Okay, so the next thing that we're going to do is to inflate the balloon with the 10 cc sterile water using the 15 to 20 syringe. So this will help us prevent the catheter from slipping out from the patient's body. And of course, if the catheter needs to be removed, then the balloon will be deflated. Okay? So you already connect the syringe and the catheter a while ago. So we're going to administer the sterile water now. Then we're going to remove the syringe. Okay. And now I'm going to remove my gloves. Okay. Okay. I'm going to discard it. I'm going to perform hand hygiene. And I'm going to wear a clean pair of gloves. Okay, so now I'm going to secure the catheter by taping it on the patient's thigh. Okay, so we're going to allow some slack of the tubing to allow or to accommodate patient's movement. Okay. I'm going to take this one. So, ma'am, are you comfortable with this? Alright. So, now I'm going to place the urine bag on an unmovable area beside the patient's bed at the level below the patient's waist. So, I'm going to place this here on this side. Okay. Just going to take this one. Alright. So now position the patient comfortably to promote relaxation. Okay, so now ma'am, I'm now going to remove the absorbent pad and the eye sheath. I'm going to discard this one. Okay, I'm going to cover up the patient. Okay, ma'am, we are now done. So I'm now going to remove your bath blanket and I'm going to cover you up with your blanket, okay? Okay. So I'm going to place this on the medical hamper. And I'm going to drape you with your blanket, ma'am. So, ma'am, how was your feeling? Alright. So, that's good to hear, ma'am. Okay. So, now, ma'am, since we are now done here, I'm now going to head out for you to have some rest. And if you need anything else, just press the button on your right side, okay? Alright, ma'am. So, do you have any questions or clarifications before I go? Okay. So, thank you, ma'am, for your cooperation and have a nice day ahead. Okay. So, now I'm going to perform the aftercare of the equipment and I'm going to perform thorough hand washing to deter the spread of pathogenic microorganisms. Okay, so now I am going to record the time the procedure was done, the amount, and the color of the initial output. Okay. Alright, so that's it for my return demonstration. I am catering Tea Canumay. Thank you for watching.